So, good morning, everyone. Hello and welcome. We are excited to be with you today for this APPIS Academy session titled Tools to Improve Patient Experiences and Outcomes in Precision Medicine and Beyond. Next slide. So my name is Nicole Wicke. I'm a program director working in the PFMD program and also the From Testing to Targeted Treatments or FT3 program. So I'll be the chair of the session today, and I'll be joined by two colleagues presenting during the session. First, Helena Harnick, who's the executive director of the FT3 program, and Elizabeth Priest on behalf of the PFMD program. So the session is available in Mandarin and Japanese, and you can click on the interpretation icon in the Zoom menu options to access the simultaneous translations. And also please use the Q&A function if you have any questions or comments or ideas to share during the presentations. And in case you have questions or comments in Mandarin or Japanese, please add them in the Q&A and we'll address them after today's session as a follow-up. And lastly, for you all to know, the session today will be recorded. You'll be able to access and share the recordings in English, Mandarin, and Japanese shortly after the session. And the slides from today will also be available with the recordings. And so before we move on, we'd just like to kindly ask you to answer a short poll on your previous experience attending APPIS sessions. So you should see the poll pop up on your screen. Just indicate if you've previously attended an event from APPIS. All right. Okay, so we have 17% have attended an APPIS event previously and 83% that haven't yet. So welcome, we're happy to have you here. Great. So on the next slide, we'll just run through our agenda for today. So our agenda today aims to help you discover some co-created tools to help improve patient experiences and outcomes in precision medicine and beyond, with particular focus on tools to support advocacy, access, and engagement. So first, Helena will introduce you to the FT3 program and a tool called the Access Barrier Cause Effect Canvas. After presenting the canvas, we'll have a co-creation activity to work through the canvas together. We'll gather your input and your experiences. And then Elizabeth will talk you through the Patient Engagement Quality Guidance, which is a co-created resource to drive best practice in patient engagement. And lastly, we'll wrap up with an overview of ways that you can get involved in the work of PFMD and FT3. So, and now I'll hand over to Helena for the next portion of our session today.
Thanks, Nicole. Hello, konnichiwa. My name is Helena Harnick, and I am the Executive Director of the From Testing to Targeted Treatments program. Next slide, please. The From Testing to Targeted Treatments program, which we call FT3 for short, is a global, collaborative, not-for-profit, multi-stakeholder program to make precision medicine an accessible reality for patients who could benefit. We believe in bringing together people from all backgrounds to create practical and sustainable solutions. Next slide, please. All aspects of the program are co-created, and here you can see the FT3 community members. Next slide, please. Our aim is to act as a global accelerator in precision medicine. We are doing this by working together to identify similar needs and good practices across many countries and turning them into practical tools and solutions to improve patient access to precision medicine at the local level. We are developing solutions in 3 focus areas: data and evidence, education and awareness, and systemic barriers to access, all with a strong focus on understanding and improving the patient experience. Next slide, please. Today, we have developed the first toolkit for precision medicine champions. These are patient advocates and other people who can act as ambassadors in increasing access to precision medicine. We are now starting to pilot these tools through country pilots. Today, we will introduce the Access Barrier Cause-Effect Canvas. We will send a follow-up survey where you can indicate your interest in learning more about these tools, or your interest in participating in developing more tools, or in participating in local pilots. Next slide, please. The Access Barrier Cause-Effect Canvas was inspired by an approach developed by Longevity Foundation, an American lung cancer patient organization and member of FT3. They created this visualization to show the pathway of a non-small cell lung cancer patient and the different stakeholders that are involved. Each dot represents a point on the patient's pathway. Next slide, please. They then mapped the barriers at each point experienced by each stakeholder. Next slide, please. And potential solutions to these barriers. Next slide, please. We were inspired to turn this into a tool that others could use beyond the patient advocate community. Members shared other examples that we drew on for inspiration. For example, there was a resource shared to us by National Oncology Alliance Rare Cancers Australia, illustrating the patient journey, what actually happened and what could happen. And another example from the IQVIA Institute, a paper called Optimizing Oncology Care Through Biomarker Adoption, Barriers and Solutions. We use these to develop a canvas or model to identify patient pathways, barriers, and solutions. We made some changes. It was very important for our members to focus more on the patient experience, including what patients feel or do and the quality of life, not just their symptoms. We also added a recommendation to complete the canvas collaboratively with other stakeholders, such as in a workshop. Next slide, please. I will now show you what the tool looks like and how you can use it. With the help of examples, users are guided step by step to fill in the pathway and identify barriers and solutions at each step of the pathway. First, the group prepares a blank canvas by drawing or printing out the canvas. Next slide, please. Then the group fills in the patient pathway. Here you can see that they have started to fill out suspected disease, tissue or liquid biopsy, and histology biomarker testing as the first 3 points of the patient pathway. And on the next slide, you can see an example completed pathway. We know that the text is small, but we will share these slides with you afterwards so you can take a look at them in more detail. Next slide, please. For each step of the pathway, the group then identifies access barriers. These are problems or practical issues experienced at each step. So here you can see on the point suspected disease, we have identified that a barrier might be that the patient is unaware of testing. At the step liquid or tissue or liquid biopsy, that a barrier might be suboptimal tissue procurement and triaging. And at the point of histology biomarker testing, which is experienced by the pathologist, that there might be challenges of multiplex testing not performed, long turnaround time, and lack of continuity of care across institutions. And on the next slide, you can see some examples of access barriers at different steps of the patient pathway. On the next slide, you'll see that we added an optional step. And here, this is where the group can collaborate to try to identify the root causes for each barrier, such as with a fishbone or Ishikawa methodology. Next slide, please. Then the group works together to try to find possible solutions for each problem identified. So if we go back to the pathway on the point of suspected disease, you can see that some potential solutions could be patient education or patient-focused research. On the point of tissue or liquid biopsy, some solutions could be to develop best practices in tissue and sample handling. And in the histology biomarker testing point, healthcare professional education, policy changes, and encouraging and incentivizing best practices and test turnaround times. And on the next slide, you can see an example completed canvas, which we can share with you after the workshop. Here you can see the canvas was presented and validated by participants at the Patient Engagement Open Forum in 2021. Here we developed an example with patient advocates of CUP or cancer of the unknown primary and was based on a real patient story. 200 participants then identified 47 potential barriers and 24 best practice examples from their focus areas. I can share with you some of the examples of barriers and good practices that are identified. In terms of barriers, some of them identified health literacy as being a barrier, which includes understanding the need to ask questions and to seek out the right doctors. Also mentioned were the limited availability of tests, and also in the situation of cancer of the unknown primary, the exhaustion that the patient feels by the high number of tests, and the fact that because of this exhaustion, the treatment might be initiated early to spare the patient. As examples of good practices, they mentioned molecular tumor boards, also including virtual tumor boards, to expand their circle of expertise across geographic areas. It was also suggested that using liquid biopsy early on could help in diagnosis and speeding up the process. And they also mentioned medical education in primary care. And we can share these results with you if anyone is interested. So if we can move to the next slide, please. So now you have been introduced to the canvas. We would love to hear from you. We would like to know what are the barriers and opportunities you experience in your country. And this will help us as a collaborative program to understand where we need to work together. So what will happen is you will receive a link in the chat. In fact, there will be 3 links, and you can choose the language that fits the best for you. So we will be focused on the English one, but there's also a link for Japanese and one for Chinese. And you will, when you go to this, you will see that there will be 2 main questions that you will see once you go through the first survey to understand your background. So we will ask you to explain what are some examples of access barriers faced by your patients. So these are the ones in red that you see on the canvas, where we would love to hear, especially the barriers that are maybe less common and experienced really in your country. And you can also upvote barriers that you have encountered or experienced if someone else has put that down already. You can also leave a comment to let us know what situation you have experienced that barrier or your patients have experienced that barrier. And there will also be a column where you can tell us about best practices or case studies that address one or more of these barriers. And I'll explain this again when we get to the screen so you can see exactly what it looks like. So if we could go to the next slide, Diana, and we may also want to show the group map itself. So it should just be, there we go. So you will click on the link and then you will see the screen and you will be prompted to add your email address, and then you should be able to join in. And we'll give everyone a few minutes to connect because we know that it can take a while. So Diana, if you would be able to move over to the group map, that would be great. And then we can show everyone how to use it. So first, you will be asked to choose your stakeholder group. And this is just to make it easier for us to analyze the answers afterwards. So you can choose the one that is most relevant to you. And then once everyone's done that, we will move you on to the next step. And this survey will stay over, this group map will stay open. It won't close right after the meeting. So if you would like to take some more time to complete it, we can definitely give you that time as well. So we'll just wait for everyone to complete this first step. And we see that there's still some people joining, so we'll give you a bit longer. We have plenty of time together, so there's no rush. So again, for those of you who are joining a bit later, we're about to start a group activity, and the first step is just to indicate your stakeholder group. Great, so here we see the results. So we see most people coming from patient organizations and also pharmaceutical companies or industry. Also some patient advocates, some researchers and HTA bodies as well. So if we continue on then, and again, this will be left open. So if you're not able to answer right away, you're on your phone, you can definitely fill this in afterwards. So I'll explain to you how this group map works. So this group map is a collaborative tool and enables us to collaborate together when we're in a virtual setting. So if you haven't used it, it's quite intuitive, so don't worry. So you have two columns here. We have the column on the left in the yellow, which is for the access barriers. And here, what we would like to invite you to do is to click on the little plus sign. Diana will show you right there. And when you click on that, you can start typing. So we would like to hear whatever barrier you have experienced in your country. It could be helpful if you could also indicate what country you're based in as well. So you can say, for example, in Japan, this is a real challenge that we face frequently. And it could be a barrier faced from patients in any condition in a precision medicine context by any stakeholder. We're just really happy to hear what you have to say there. It's quite interesting for us to compare with the results we had previously. And then on the right-hand side in the green, you can also add any best practices or case studies that address one or more of these barriers. And the same idea, you click on the plus and you can start typing. And again, you can upvote, so you can click on the thumbs up sign if you have experienced that barrier. And you can also add a comment. You just click on the idea that has been posted. You can add a comment to explain a little bit more about your experience with this barrier or with the best practice as well. And so we'll give everyone a few minutes to start to complete that. And again, this will be left open after the meeting. So if you'd like to take a bit more time, we'd love to see your ideas now, but if you'd like to take a bit more time after the meeting and share that with your colleagues, we'd be really happy to hear from you. So I see access and awareness of genomic testing is an idea that's come up. And India, limitations in medical and health insurance. Thank you for sharing that. So again, please, when you're adding barriers, it's very helpful to know which country you're based in, because we know that precision medicine varies a lot from country to country. Or if you're familiar with several different countries, you could list those down as well. And in terms of barriers, we're also interested in hearing maybe about the less common barriers. And it could be from the patient perspective, it could be from the healthcare professional perspective, pathologist, payer perspective, caregiver perspective as well. That is something that was raised in previous discussions on this Canvas. So I've seen late diagnosis as well, insufficient screening programs, reimbursement. That's something we hear a lot of the drug or test. And some best practices in there as well, capacity building. And I see some comments going in as well, so please don't hesitate again to add a comment if you have experienced that, and you can give us a bit more color with whether it's Southeast Asia, lack of understanding among patients about what precision medicine tests are and what they're for. And so they don't understand why they have to pay so much for such tests. Very helpful, thank you. So I've also seen a point about collaboration between pharma companies, so multiple tests run on a single sample, and also plain language summaries in multiple languages on the science and safety of therapies. That's very interesting. Indeed, that's something, a point that comes up a lot. We've heard a lot about the importance of being able to understand the testing reports as well. I'm curious to see if that's something that you experience in your country as well. Another idea, multi-stakeholder approach across the Asia-Pacific region. And access and awareness of genomic testing and costs involved. Indeed, that is a theme that we have heard as well. And we're also interested in both barriers and best practices at all steps of the patient pathway. So it could be at the very early stage, the kind of suspected disease stage. It could also be later on in the process as well. And of course, we're interested in hearing about different stakeholder perspectives too. Something that we discuss quite a lot in the FT3 program is also beyond kind of just awareness and education is the challenges, more operational challenges that are faced, like in tissue acquisition. So these are the kinds of things that we're also really interested in hearing about. And also maybe going a little bit more deeply into some of these ideas. So if it's a point about reimbursement, you know, is there a specific challenge about reimbursement that we need to focus on? For example, the difficulty in identifying a specific kind of evidence. We'd be really interested in hearing all these different ideas. And thanks, Mark. You've shared a resource, really helpful. Thank you for that. So I think we'll give everyone just a few more minutes to complete this because I see some ideas still coming in. There's cost of treatment there. And again, we'll leave this open and you know, you'd be really welcome to share this with your colleagues and ask them to fill it in as well. It'd be really nice to have a snapshot across Asia Pacific, Africa, Middle East region about the different kinds of barriers and good practices experienced to see if there is a pattern or indeed there might be differences between different countries. And yes, for those of you who've joined a bit later, you might have missed the link. My colleague Maxi has just posted it in. If you scroll up in the chat, you'll also see links for Japanese and Chinese. And we won't be reviewing those other languages today live, but we will review them after the meeting and we'll share the results with you. So I'm looking forward to seeing what other ideas might be there too. So again, for those of you who are just joining, you will see the screen on the left is for the barriers and on the right is for the best practices. All you need to do is to click on the little plus sign and start typing. As my colleague Diana is showing, you can just click on the plus sign and you can press the thumbs up button if you have experienced that barrier, and you can add a comment if you want to add a bit more color to what your specific experience was. So just coming back to the ideas that are being posted, I see another best practice that was shared, unbranded cancer type patient materials. That's really interesting. In fact, that's something that we have started to work on in FT3, is to develop adaptable resources. So resources that are based on good practices in different countries and basically designed to be adapted to the local context. So to the specific geography that you're from, or from the specific condition type. As an idea that this would be quite helpful for advocates and other kinds of potential ambassadors of precision medicine. And as a reminder for those who are recently joining the group map, if you are adding an idea or a comment, if you could just indicate what country you're based in, that would help us with the analysis afterwards. And I hear from my colleagues that we also have some ideas coming in on the other group maps, so it'll be really interesting to see what you have put there as well. Yeah, I see a new idea, creating patient support groups based on gene fusion rather than tumor type. That's really interesting. If you have examples of specific patient support groups, we'd love to hear from you. We know that at least in North America, we've been hearing a lot about these groups. There's one that we've come across called the Biomarker Collaborative recently, and I'm really curious to hear if you have similar groups in the Asia Pacific or Africa, Middle East region. And if you could refer us to the names, we'd be really interested in getting in touch with them. So we'll just give everyone maybe 2 more minutes, and then we can continue on with our presentation this morning. I see a comment has gone in for the health literacy point. So health literacy is a barrier. Definitions of precision medicine, indeed, that's something that we have heard of before as well. And thanks for sharing that link. Great. So I'm just checking with my colleagues if there is still content going into the other group maps in Japanese and Chinese, and if we should give them a few more minutes. Okay, so as a reminder, we will leave these group maps open. I think what we could do is maybe circulate the links after this meeting as well as a reminder, and we'll leave them open for a few more days. And we'd really encourage you to come in and complete this. We'd love to have a list of different kinds of barriers and good practices experienced in different countries. As a comparison with this patient engagement open forum session we had last year with more North American and European contacts, it'd be really valuable to get this breadth of experience. And for now, what we'll do is we'll continue on with the next part of the presentation with patient-focused medicines development. So once we come back to the presentation, I'll hand back over to my colleague, Elizabeth. Thank you.
Thank you so much, Helena. Hi, everyone. Good morning, good afternoon. I'm Elizabeth Priest, and I'm a program director with Patient-Focused Medicines Development, PFMD. So Helena and the team walked you through the From Testing and Targeted Treatments FT3 Canvas. As I mentioned, a tool to support access and advocacy in precision medicine. So now I'm going to be focusing a little bit more about the how you can achieve your goals working with patients, how to work most effectively in a multi-stakeholder context. Therefore, let's pivot now towards PFMD and how to achieve quality patient engagement through PFMD's patient engagement quality guidance. So before we jump into things, I'm going to start with a quick introduction to PFMD. You can go ahead and go to the next slide. Starting from the beginning, if we take a look at the complex landscape of patient engagement, we see there are many different entities, stakeholders, themes, and work all aiming towards better systematic patient engagement. The complex landscape and ecosystem require collaboration and alignment to ensure there's no duplication of efforts and that patients' voice is systematically integrated to benefit research, development, and delivery of medical products, treatments, and care. So even beyond medicine's development. Next slide. Now we're seeing widely in the US and Europe that the public discourse around public and patient involvement is shifting from the risk of investing in and doing patient engagement towards having a bigger risk of not involving patients. As a result, we want to help all individuals and organizations across the globe in co-creating with patients and leveraging the lessons learned to date. Even if maturity is variable for given stakeholder groups and geographies, we've seen the global trend is very strong and accelerating positively. Next slide. Enter PFMD. PFMD is a collaboration of like-minded organizations that want to drive PE forward to improve health outcomes overall by integrating the patient voice systematically. So listed on this slide are members which make up PFMD. We also want to highlight a few of our ongoing collaborations and partnerships, such as PFMD and Japanese Partners for Patient-Centric Care, JPPAC. This collaboration began in 2022, and just a few short months together, we've been able to translate and focus global tools and resources to a more local level. A collaboration and partnership we hope that we can learn from and replicate across other regions and countries. In addition, PFMD is a main contributor to the National Cancer Center Japan research study on the comparison of patient engagement and involvement in clinical studies in Europe and Japan. We are looking for individuals to participate in a short survey to support the quantification and comparison of patient engagement between Europe and Japan, with the target to lead to concrete proposals to advance the drug development pathway in both regions. So if you're interested in getting involved and taking the survey, please let us know in our short questionnaire after this webinar. Next slide. At PFMD, we have 3 core goals as part of our PE25 strategy. These include scaling PE deeper within organizations and wider to new stakeholders, building the conditions and enablers of PE, and building PE in digital health and data. This is the framework which supports all of our work and our mission. Now, I say this because this mission could not be accomplished alone, and we need your support, and we look to spread meaningful quality PE wider. Next slide. One of PFMD's key resources is the PE quality guidance. The PE quality guidance is a practical guide to planning, developing, and assessing the quality of patient engagement activities and projects. While this resource was created with medicine's development in mind, it is a key resource that can be applied across many activities where there is a need to work with patients or even co-create in a multi-stakeholder partnership. So even for things related to precision medicine, as Helena walked us through earlier. The PE quality guidance proposes 7 quality criteria, which have all been co-created, and many of which are supported by pre-existing patient engagement frameworks. These include starting with a clear shared purpose, respect and accessibility, representativeness of stakeholders, determined roles and responsibilities, capacity and capability for engagement, transparency in communication and documentation, and continuity and sustainability. Next slide. 3 things make the PE quality guidance a unique and timeless resource, and that I want to point out for you today. One is the tool itself was built in a multi-stakeholder working group. It was co-developed with a large community of stakeholders, more than 100 people from 51 organizations representing patient associations, industry, academics, researchers, and external experts. It's simple to use. Anyone working on patient engagement projects, for example, patient advocates, researchers, payers, can use the PE quality guidance. And third, it's suitable for all projects, and it can be used as a planning tool when starting new initiatives or to support the evaluation of past initiatives. It's a resource that itself is a downloadable PDF which can explain a process for successful PE across the 7 criteria. It includes guiding questions along the way to make the tool simple and easy to use. In the chat, we'll share the link to access the English version of the PE quality guidance. It's available right now for medicines development and medical devices. We are actively looking for ways to bring the guidance to more cultures and in more languages. Currently, PFMD and JPPAC, for example, are almost finished translating the guidance into Japanese, and we look forward to launching it later this year. The PE quality guidance is all about building strong multi-stakeholder collaborations and supporting meaningful PE. Next slide. So we also wanted to point out that the quality guidance is part of a broader patient engagement management suite. We will also be sharing the link in the chat here shortly, where you can access the patient engagement management suite itself, many PFMD and PE resources to help you engage with patients and in multi-stakeholder relationships. We hope that you can access the survey at the end of this webinar to help us determine which of these resources in the patient engagement management suite would be most beneficial to you and your context. Next slide. So before we move forward and wrap up this section, we also want to get you involved and hear from you by asking you to participate in a short Zoom poll. So we have 4 poll questions for you today. Each question will be presented in Mandarin, Japanese, and English. So please just scroll down if you don't see your preferred language right away. And let's go. So we have the first question launched. Once we reach about 80% of completion of the poll, we'll go ahead and show the results to everyone. And you can see here, the goal is really to just understand a little bit of a baseline about how you would rate patient engagement quality when engaging with patients for medicines development or anywhere in your experience. So with 10 being excellent and 1 being non-existent. I think we're just going to give everyone a few more minutes, and then if we can go ahead and show the results. Oh, I see. Thanks, Liz. I see a question here that says that we are unable to press the answer. If you could just go through and answer the same answer in all 3 languages, that would be very helpful for us. Thanks for pointing that out, Liz. So it looks like we're just having a little bit of technical difficulties with the survey poll here. So we'll just go ahead and, yep, okay, great. Thanks, everyone. Thank you for sticking with us. And there we have the results. Wonderful. It looks like the majority of us are right around a 4 all across the board. 32% out of 4 with even, it's great to see that no one is at a 1 or a 2. And we do have a few 7, 8s, and 9s, which is really great to see. So average is right about there in the middle with a slight lean towards the top. So then we're going to launch the second question. And if you could just do the same, please, and answer the same for all 3 languages, we would greatly appreciate it. And for this one, the top will be yes. The first answer will be yes, and the second answer will be no across all 3 languages. And same, we'll just give everyone a few more minutes, and then we'll go ahead and launch the results. Okay, Maxie, if we can go ahead and show those results. Okay, so overwhelmingly here we have about 95% saying that you do not use a tool or resource such as the PE quality guidance to support in working with patients. The third, we'd like to gauge a little bit if you are familiar with the PE quality guidance already, or if this is the first time that you have ever heard about it. So this is the same, the order of the answers will be the same across all 3 languages. So for the first one, it'll, yes, very familiar with the patient engagement quality guidance already. Yes, you've heard about it, but only a little bit. And then third, no, this is the first time I've heard about this tool. All right, Max, if we could go ahead and show the results. Okay, great. So it looks like this is the first time that a lot of you have heard about the patient engagement quality guidance. That's great to hear from us because our next question will actively feed into some of our next steps, both for the patient engagement quality guidance itself, but then also how we can move forward with further APPIS Academy sessions to try and make sure that this is the right tool for all of you. So if we could launch the very last question for you today, it is, so the question actually here is, do you think the patient engagement quality guidance would support your work? Yes, if translated into my language, I think it could be helpful. Yes, but beyond being translated, it should also be tailored to my local context and country. Or no, I already use something like it, or it's not quite applicable for my work. And as you can see here, the 4 answers will remain in the same order, so please select them across the way. Thank you so much for your patience on this as we try to bring it and make it accessible across all 3 languages. Okay, great, Maxie, if you could go ahead, show us the results. Okay. So 76% saying yes, but in addition to being translated, it should also be tailored to a local context and country. Thank you very much for your feedback on this. We encourage you to also let us now know what else you're interested in learning about through the survey after this webinar. So next slide, please. Lastly, we'd like to share with you the patient engagement Synapse. Synapse is a platform and the network for patient engagement. It's a platform which empowers all stakeholders by mapping and connecting experts, organizations, events, initiatives, and resources in patient engagement. It's truly a digital solution which aims to connect the whole community and empower the ecosystem to be more efficient with understanding, connecting, collaborating, managing, and supporting meaningful PE. So Synapse is available for specific ecosystems such as patient engagement, precision medicine, associated with the From Testing to Targeted Treatments project, medical devices, and others. So actually, if you registered for this webinar, then you're already familiar with the page. We encourage you to explore the platform, log in, complete your profile, connect with other organizations and professionals, and use the Synapse network to promote your initiatives in PE as well. We're also very excited to announce today that Synapse is available in Japanese through the hard work and collaboration of our partners at JPPAC. So thank you so much for your time today. This is our first time doing a session like this with the APPIS Academy, so we very much look forward to aggregating the results from the survey, incorporating and learning from your feedback, both from the questionnaires and polls we've done, but also from the post-session feedback forums, in order to inform our next session. So with that, I will hand back over to Nicole.
Thanks, Elizabeth, and thank you all for your really helpful insights that you've shared today in the group map and through the polls. So on the next slide, I'm just going to talk you guys through a few different ways that you can get involved in the work of FT3 and PFMD. So here we've highlighted 5 different ways that you can get involved. So firstly, let us know if you're interested in joining one of our co-creation working groups, if something that we've discussed today or that you've seen on our websites looks interesting to you. Second would be to provide your input to our work through one of our public consultations. So you can follow our social media channels, see what public consultations we have running on different projects and deliverables in those projects, and also then stay up to date when new ones are launched. Third, you can share with us your priorities and give us your feedback from today's session. So this can help us in shaping future sessions for the APPIS Academy and through our respective programs. Fourth, if you might be interested in piloting one of the tools from today or others from PFMD or FT3, and do let us know. And then lastly, get involved by registering on our Synapse platform. So there's patient engagement Synapse and precision medicine Synapse. The Synapse ecosystem is a great place to find resources, and learn about things taking place in patient engagement and precision medicine. So you can go on there, create a profile, browse around. There's training, events, people, organizations, really a comprehensive map of the precision medicine and patient engagement ecosystem. So, and then lastly, there's a follow-up survey. This link will be available to you in the chat and will also be circulated with all of you. Please give us your feedback, and you can also indicate through this survey if you'd like to get involved and how. So you'll see there in the chat that the link is available there. Please click that link and provide us with your feedback from today. And we look forward to hearing from you. And so with that, on behalf of PFMD, FT3, the speakers from today and the APPIS Academy, thank you all for your time and your helpful contributions to today's session. Thanks again to the APPIS Academy for inviting us to join you today. And please don't forget to respond to the follow-up survey and give us your feedback. We hope to see you again soon. Thanks again. Have a great afternoon, a great day, and see you next time.